Let's get started. Hello, everyone. I'd like to welcome you to the Medical Marijuana Awareness Seminar. This evening, we're going to be talking about dosing. Medical marijuana dosing is very important to being able to have a successful experience and, more importantly, to help you get your life back. It's a subject that is not discussed a lot, but it's one of the key subjects to being able to have, again, not only a successful program with it, but also being able to really help you get the fullest extent out of all the things that you've done with medical marijuana. I really want to be able to emphasize the fact that this is probably one of the most important webinars that we put on. And I want to have you understand also, we want you to ask questions. The reason for we do these webinars is to have you be able to get your questions answered and to be able to help you really with your particular medical marijuana regime. Now, you'll see a little Q&A. Looks like a third one in, that little Q&A button. The questions can be asked there, and please feel free to do that. That's what we're here for. And then also there's a chat button, but what we'll use the chat mainly for is we're not gonna really use it much. We're gonna use the Q&A button to really answer questions. So this is an important subject. And like I mentioned, you have to have some professionals that really help you answer this question. And we have two very good pharmacists right now who have been working in this field for quite some time and really have some experience at this. So I'd like to introduce them at this time. So let me start by Cameron. Why don't you introduce yourself, tell us a little bit about yourself and what you do.
Yeah, sure. Good evening, everyone. I hope everyone's doing well out there. I notice we've got a lot of people from all over the state of Florida, a few from New York, so it's very exciting. Like Marc said, my name is Cameron Vance. I am a pharmacist and CIO at MMTC of Florida. We're a medical doctors group here in the state of Florida. I've been involved in medical marijuana, the cannabis space, really since the very beginning. Really since the first dose, honestly, was delivered to a patient here in Florida. And I've become very passionate about the topic. I've seen medical marijuana impact so many lives in such a positive way. It's just been, honestly fantastic. Aside from MMTC, I was appointed to the Medical Marijuana Advisory Committee in Florida under Nikki Freed. The idea behind that is to come up with ideas to improve the medical marijuana space here in Florida by making recommendations to her and then to the legislature. And also currently co-chair a medical marijuana research consortium where we're putting together different research topics to really expand the base of knowledge specifically with Floridians in the medical program that we have here. So very excited to be with you all. Thank you, Marc, for inviting me on tonight.
And Cameron, thank you for joining us. I know that you've helped many patients, including myself. So, and you've been at this for a number of years. So your wisdom and your sage wisdom is welcome. Another key player is Turner Davis. Turner, you're COO of Medical Marijuana Treatment Clinics, MMTC, and you've treated thousands of patients, or your clinics have treated thousands of patients. Tell us a little bit about yourself.
Yeah, thanks, Marc. Yeah, I appreciate the invite to be on here today. I always enjoy the opportunity to discuss the subject and educate a little bit on medical marijuana. Yeah, I've been working in the field since about 2012 or so. Got involved pretty early on. When the state of Florida legalized medical cannabis, it kind of went in phases. It started with, it's always medical, but it started with high CBD products only, and then expanded into the full spectrum CBD THC products. And we actually started working as pharmacists with one of the original dispensaries that won a license in Florida, and I was able to work with them, educate, really learn a lot about medical marijuana. Actually helped them set up their original lab, and really did a lot of work with products, and talking to guys from California who had decades of experience working with the medical products and in the cannabis field. And so yeah, it's been really, really educational, really exciting to see the patient responses that we get with medical marijuana. Being a pharmacist for almost 20 years now, I've seen patients really decline with typical treatments, especially with opiates, trying to treat pain and chronic pain, those sorts of things, and really have a lot of side effects, a lot of negative effects from addiction, from ever increasing doses of opiates and other types of pain medications. So this has been very refreshing, working in this field, seeing the great responses patients get, and improving their quality of life, really, which is we don't always see with some pain medications. They may get a little pain relief, but a lot of their other areas of life suffer. And we're really able to avoid a lot of that here with the medical marijuana. So that's been rewarding, and working with the doctors with MMTC, learning from them, as well as educating them on medical marijuana. I think we've really created and been able to provide a good service here in the state to a lot of patients. So, but again, I appreciate the invite and the chance to speak to everyone tonight.
Great, fantastic. And again, you spent a lot of time in this field with patients, and you spent a lot of time running around the state in all your clinics, not only visiting patients, but we did webinars for 3 years. So I want to just jump right into the subject matter. I don't want to make this a slideware presentation, but we do have to have some slides as talking points, and I think you guys have prepared a pretty good presentation. And Cameron, why don't you kind of take it away and take it from here? Again, we want to be able to answer your questions. We want to be able to help you. Our goal with this webinar series is if we can have one person get their life back, we can have one person really use medical cannabis to improve their life, we think we've been successful. Now, naturally, we want to do more than that, but we can't answer that unless you get involved. So please let us know. So Cameron, let us know. Why don't you tell us a little bit about medical cannabis, or about dosing, excuse me.
Yeah, absolutely. Do you have my screen here?
We got it. Yes.
Excellent. Let's just dive right into it. So medical cannabis, finding your dose is a topic, super important topic. So I'm glad you all made time to be on here tonight. There's a lot of misinformation out there. There's a lot of good information out there. And my goal is to help, and Turner's goal as well, is to help you navigate through some of the process. So before I jump right into dosing, I think it's important that we touch a little bit on why medical marijuana works, where the dose is really targeting. I promise to be brief on that, but I think it will give value to understanding the importance of finding your appropriate dose. So to get started with medical marijuana, you really have to start with what's known as the endocannabinoid system. I found throughout my experience that more and more people are becoming educated on this. The endocannabinoid system, quite frankly, is where medical marijuana really does its work. Each one of us has an endocannabinoid system. All vertebrates do, even fish do. And it's just like any other system to a degree. We all have a respiratory system. If we have trouble breathing, we have asthma, something like that. If that system's not functioning appropriately, we could have, for an example, an asthma attack, and we'll use a medication to restore that system to make it, back to normal. Same with the cardiovascular system. Things are going great. Then we start finding out maybe we have high blood pressure, maybe we have an elevated heart rate. And what we'll do is we'll add medications to just restore that system, ideally to a normal baseline function. And what cannabis is doing in a very unique way is, as we progress with different disease states, what's really interesting is that science has demonstrated us that the endocannabinoid system is involved in virtually every disease state, that we have. So cannabis works in a way to really restore that balance and get us all back to a better functioning state. So when we talk about the endocannabinoid system, we really got to think about three things. Number one is our body has receptors, okay? Number two, we have something that binds to the receptor. These are generally thought of as endocannabinoids. And then we have a molecule that takes that binding and breaks it apart. And it starts over again all throughout the day. While we're sitting here right now, if we're experiencing any pain or not, this is happening in our bodies. The two primary receptors that we understand, but there are more, are the CB1 and CB2 receptors. The CB1 receptors are kind of here on the slide in a lime green. They're thought to be primarily in the brain and the spinal cord. And then the CB2 receptors are in blue. They're really thought to be more immune-related receptors. find high concentrations in some of the blood cells, the spleen, tonsils, for example. And again, there are many more. And then we have these, what are called endocannabinoids that bind to this receptor. For example, AEA, which is anandamide, is one of the primary ones. Some people call it the bliss molecule, is how it's been referred to. And another one is 2AG, which is 2-arachidonoglycerol. And what's happening right now in your body, like I mentioned before, is this AEA and 2AG are binding to your receptor. And then you have the third part, the molecule, that breaks it off, FAAH and MAGL. So right now, as we sit here, binding, releasing, binding, releasing. What happens in some of these disease states is the binding and releasing isn't happening in an appropriate fashion. What happens is with some of the binding and releasing is we have downstream processes that have an impact on a lot of different neurotransmitters that are related to pain, seizures, all kinds of different things, like you may have heard of serotonin, gabapentin, acetylcholine, and it goes on and on. And whenever that gets out of balance, what cannabis does, kind of in an adaptogenic way, if you need more, it kind of supports more. If you need less, kind of supports less, restores that balance. And what's been really unique throughout the research is that a lot of the big pharma companies right now are looking at molecules where they can, make synthetic, for example, versions of AEA, or how do we make a molecule that, slows down FAAH so AEA can stay bound up tighter. There's a lot of research in that space. And in fact, there was a medication called Rimonabant back in a while back, was released on the market in the UK as a weight loss type of drug. What the idea was is, you'd heard about cannabis, marijuana, the munchies, things like that. Along those same lines, they thought, well, what if we can block this CB1 receptor? That's the one in green. Maybe we can, maybe we can stop some of the obesity. And the drug came onto the market. It blocked that receptor, essentially cutting off a lot of this cascade. And those patients expressed different psychological disorders. There was actually suicides that came from it. The drug was immediately pulled from the market once it made it out. And another way, unfortunately, that we began to understand the importance of having a well-functioning endocannabinoid system. Whenever we talk about medical marijuana, specifically, here in Florida, really throughout the country, I saw some people from Arizona, New York as well. A lot of times what you're going to hear about primarily is THC. That is what most of us think of as the psychoactive part of cannabis. That's the part that can have, has the ability to quote unquote get you high, give you a euphoria. And then you have CBD, cannabidiol. It's thought of as the component that really doesn't get you high at all, really. It's kind of like the yin and yang. They're kind of the polar opposites, if you will. And it can be found in hemp, for example. You probably in your community see signs all over the place. We have CBD, things like that. That's what that's referring to, the non-psychoactive component of cannabis. But in the cannabis space, what's important to remember is that it's so much more than just CBD and THC, though those are the really important, and most of our research right now is there. You can see in this graph, there's a lot of additional chemicals within the cannabis plant, like delta-8 THC, CBCA, CBC. And a lot of the research that's coming out and that we have is showing a lot of value in these additional chemicals. So it's just something I think it's important to keep in the back of your mind. When I got started and what I hear from a lot of patients, and it's a fair question, it's how can cannabis do so many different things? How does it treat somebody with seizure disorder, but it also helps me with my fibromyalgia? What you have to remember with cannabis is that it's not just one component. When you think about Tylenol, for example, at the end of the day, Tylenol is Tylenol. It's one drug. As good as it is or as bad as it is, it's one thing. cannabis is so much more. And as a patient, as we put each of these components together, where we dial in and find our individual dose, our amount of CBD, our amount of THC, and these additional components here, they work together in a harmony, if you will, to give you the best response. It's not one size fits all medicine, and that's very important to accept from the beginning and understand. It's going to be something that you're going to try different formulations, things like that, until you dial in exactly what's right for you.
Cameron,
Because that
I think
endocannabinoid system.
I'd like to make a comment. In a Sanjay Gupta video I saw, he mentioned that there were over 450 medical properties in the cannabis plant. And I think that CBD wheel that you were showing earlier was basically listing all the different all the different medical properties that can help your body. And what's interesting is that those particular medical properties are triggered by, as you mentioned in the earlier slide, are triggered by your nervous system. In other words, your neurons know you have a problem, so they trigger the endocannabinoids to help your body. And your body knows where you have a problem. You don't need a doctor to tell you that. So if you take it for inflammation in your knee, for example, it may help you with the pain in your shoulder because your body knows that it's there. It doesn't necessarily need directions for that. And that's the amazing thing about cannabis. That's what's called the entourage effect. Many people take it for one thing and find out it helps them with other parts of their body.
Exactly. Yep. The entourage, by and large, is the thought that you don't. It's not just one chemical by itself that's going to do someone, enough necessarily. Like you'll see around town, like I mentioned, the CBD stores, and they're on them. These products are on the market because for a lot of people, they're working, and that is one component. But patients have a lot more benefit from multiple portions of these chemicals working together, and in the different disease states. If you got a lot of pain and these signals that are popping off telling your brain, hey, I'm hurting, what cannabis can do is interact with that receptor. It can bind presynaptic, it's called presynaptically, and it slows down that firing to help with pain, neuropathic, a lot of different things. Now, as far as, one thing to think about with your dosing and the type of products you're buying, I see a lot of people come to me and they go in a dispensary, they get overwhelmed, and it's a fair point. You're not alone. It can be a little overwhelming, but I want to help to kind of help you weed through it a little bit. These on this graph here on these photos, these are what we know as terpenes. There are terpenes that are specific to the cannabis plant, but there's terpenes in virtually our everyday lives. Anyone that drinks a glass of wine and they swirl, sniff, all of that, a lot of what's in there is terpenes. For example, on the top right of your screen, you'll see beta-myrcene. Beta-myrcene is a terpene that we use in aromatherapy often. It's in lavender. So why would somebody use lavender? A lot of us use it around the house for the calming effects, for anxiety, to help with sleep, things like that. You'll see linalool, a photo there. It's found in hops. A lot of people, drink wine, drink beer a little bit. Some of the hops, can cause a little drowsiness. So whenever we get to the dispensary, we're going to have CBD, we're going to have THC, we're going to have those other little components as well. Great. But then you're going to have different strain variations, and don't get too wound up on it. A lot of the dispensaries, they'll market them by as sativa, indica, hybrid. There's a lot of debate whether those terms should be used or not, but when you start to look at things, something like an indica helps you sleep. And the reason for that is it's going to have a lot more, for example, of the beta-myrcene in it, and something that's going to, keep you, if you're trying to go to work during the day and be awake, and something with a lot of beta-myrcene is something you would, obviously tailor back, and you can use cannabis during the day and be completely fine, have energy. A lot of people look at cannabis as just giving you couch lock, but it can do the exact opposite. It can give you a lot of energy if you're using the right, sativa type or hybrid formulations. So just keep that in mind as we move through the presentation. If you've had the opportunity to look at a cannabis plant, the bottom right is under a microscope. You'll see this waxy residue. It's known as a trichome. And there are CBD, THC, cannabinoids, terpenes all throughout the cannabis plant. But the majority of them, the highest concentration is in these little waxy residues right on the surface. And if you inspect under the naked eye in the other photograph, you can see these white little dots. That's, at the end of the day, for the most part, these dispensaries that are making your final formulations, this is what they're spending a lot of money on equipment to extract, to break off or remove that waxy residue from the surface of the plant, so that they can formulate it into your final formulation, which I think is really, really interesting stuff. From here, what I'm going to do is I'm going to take a brief pause for a glass of water and let Turner jump in on some of the cannabis strategies. And then I'll come back in the end to really help you dial in and think about some of the dosing, some of the pitfalls, things to think about and help you navigate.
But before you leave that, it's important to understand, especially if you're new to medical cannabis, you went through a number of things like the different strains, and you talked about the endocannabinoid system and the terpenes. Really, when you go into a dispensary, the doctor has made a recommendation, and the bud tender behind the counter can actually see the recommendation. And then based on that, they know their products, and based on the recommendation and talking to you about your condition, they'll tell you what their products would probably be the best ones to work. And I say that because you walk in, it can be overwhelming. How do they know which products work? Because they know the strains, they know the different terpene profiles that address that particular, that are best at addressing that particular situation. So it's not something that you need to be concerned about. I think what you want to do is you want to talk to your dispenser, your doctor. You want to talk to the dispensary, and more importantly, listen to your body. Your body will tell you what's working and what's not working. Is that safe to say, Cameron?
Yeah, for sure.
Okay, cool. Turner, tell us about dosing.
Yeah, absolutely. I appreciate it, Cameron. Yeah, I'll take over for Cameron for just a moment here. So Cameron went over some really good information about we can call it theory or this really scientific piece of medical cannabis, why it works and how it works. I want to dig into a little bit more practical application on these next few slides about how patients, use medical cannabis day to day, and what some of the best strategies as far as concepts of dosing that can really help, hopefully help you understand a little bit of sort of the ideal way to use medical marijuana for most people. So I have a couple of slides here. Just wanted to share. These are really good indicative patients of what we see in our clinics. Typically our patients are older, not all 98 years old like Ms. Brune here, but still, older, chronically ill, have conditions they're trying to treat and improve their quality of life. And this was a good, I think a good article that I found in the New York Times. This is, like I said, Ruth Brune. She lives in a retirement community, takes a green cannabis capsule every morning for peripheral neuropathy, which is a very common pain, a pain condition that a lot of folks deal with. It's hard to treat. And what she says in the article is that she takes this green cannabis capsule every morning, and she says when she takes it, she doesn't feel high or stoned. All she knows is she feels better. And again, that's indicative of what we're trying to do. We're trying to get the medical benefits of cannabis while trying to avoid the side effects. And when in the medical field, what we call a side effect is that high or intoxication that can occur from higher doses of THC specifically, but medical cannabis that contains THC as well. So again, that's really the concept we're trying to get there is that control your symptoms, minimize side effects. Oops, went the wrong way there. This is from the opposite coast. This is from San Francisco. Carrie Stiles here takes cannabis for insomnia each evening. And, this is a good picture too, because this is really what cannabis looks like, medical cannabis looks like for a lot of patients in Florida, is their drops, their, capsules, their oral dosage forms, as well as vaporizers and plant product. But, there's a lot of options out there to help patients find their best dose and to be able to repeat that dose time after time. That's an important thing from a medical perspective. Is if once you find the dose that works for you, you want to be able to repeat that dose and do it, the same thing every day. So, we talk about, again, treating your medical conditions, avoiding side effects, and there's actually a term for that. It's called microdosing, and that basically means using the minimum dose possible to achieve the therapeutic outcome that you're looking for. In this case, controlling your pain or your anxiety or whatever your symptom may be, while avoiding side effects. The goal is relief with minimal side effects. Again, when we talk about microdosing, there's actually a lot of benefit beyond just, avoiding side effects. We actually, by using microdosing as a strategy, we can actually increase the efficacy of the medication and allow it to work better for longer for a lot of patients. People report better mood, reduced anxiety, a lot of benefits with microdosing without the adverse effects. A lot of patients find that about 1 to 5 milligrams per dose of total cannabinoid works well as a microdose. For perspective, 5 to 10 milligrams of THC is typical in a joint or a marijuana cigarette. Typically, when we talk about total cannabinoids, that's the combination of all the different cannabinoids Cameron was talking about in the entourage effect, but mainly we're usually talking about combination of THC and CBD. So it depends on the ratio we're talking about there. If it's 1 to 1, it'd be 2.5 milligrams of CBD, 2.5 milligrams of THC, just as an example, but there's all sorts of ratios out there. And again, finding the best type product that works for you. The challenge with
now, Turner, one of the things about microdosing, what you're really talking about is if a doctor recommends, for example, taking 25 milligrams of a product like a 1 to 1, what you're talking about is maybe taking 5 during the day, using 5 milligram doses rather than all 25 at once. Like spreading it out.
Yeah, exactly. That's per. You're right. Exactly. That 1 to 5 milligrams. That's per dose. So whatever, if you're using a vaporizer pen every 3 to 4 hours, that you could be using 2 to 3 milligrams every 3 to 4 hours, or if it's an oral dosage form, you may take, if you're taking 25 milligrams a day, you would take like 12 and a half. Yeah. So you're exactly right. It all depends on what you're using as a dosage form and what works best for you in that perspective.
So instead of all at once, what you're doing is you're spreading it out over time. So, for example, in the morning morning or an afternoon, you might take 5 little drops rather than one of the big doses. And what it does, it kind of spreads it out, and it's easier for your body to absorb it and to manage it.
Yeah, exactly. Well, it keeps you, what we call a steady state in your body, where you keep an average amount of cannabinoids in your bloodstream, throughout the day. And that's sort of the goal, to really control your symptoms, as best as possible. What makes dosing medical marijuana challenging from a medical perspective is just that cannabis has a lot of individual variation between patients. It's unusual that way. And Cameron talked about that endocannabinoid system, those CB1, CB2 receptors. That allows, because it's so spread throughout the body, there's so many of those cannabinoid receptors that play such an important role in people's bodies. There can be a lot of variation from one person to the next about how that their endocannabinoid system works, how many receptors they have, how sensitive they are to the different medications. So while some patients can use very small doses and get great results, some patients have to use much higher doses. We've seen some patients take 5 milligrams a day and get great results, while other patients may need 300 or 400 milligrams a day to get those same results. So it can really be a wide variation. We find an average, just as for most patients, somewhere between 30 and 50 milligrams of cannabinoids a day is sort of the sweet spot for most patients to get, good benefit for their conditions. And again, like we talked about, that's split up throughout the day. So, it may be three doses of 10 milligrams, for 30 milligrams a day or something like that. But that's typical dosing of what we see. But they can, again, get much higher. And again, one of the most unusual things about cannabis is that it has such a wide, what we call therapeutic window, in the fact that, you can take very high doses and it won't be toxic. It's just not something that our body is able to overdose on very easily. You have to take, well, it's basically impossible to overdose with cannabis just because it doesn't affect the parts of the brain that cause those serious overdose effects like opiates can.
One of the things I want to point out here is go back for a second. A lot of people ask about, we talk about your tolerance for cannabis, and some people have high and low tolerances. I kind of liken it very much to alcohol. We all have friends that, they have one drink and they're kind of done for the night, and you have other friends that can drink the bottle and they're still good. That has to do with how their body processes, in this case, alcohol, or in what we're talking
exactly.
about, marijuana. And so it's not a matter of how big or strong you are, it's a matter of how your body reacts to it. I think that's important to understand.
That's right. Absolutely. Yeah, now genetic factors, metabolism factors, all sorts of things, size, as well as size, body weight, all those sorts of things kind of go into that variation. And it really does can cause a very wide range of dosage to cause different effects for different people. Yeah. This multiphasic dose response is sort of what we call, usually medications have what they call a monophasic dose response relationship, whereas you take more medication of a certain type. I think Cameron mentioned Tylenol earlier. The more you take, you get a more symptom relief until you get to a certain point, and then that symptom relief sort of stops and you start getting more and more side effects. With cannabis, because of that wide variation that patients have, you don't have this monophasic relationship. You have a multiphasic relationship where, it's not necessarily directly dose related between different patients. So, again, that's just a different way to explain what we've been talking about, how there is big variation between effective doses for a lot of patients. So, it comes to the question is, if we take more, does it work better? And for most cannabis users, definitely, the higher doses that you take, you will certainly get more of a stronger effect with your symptoms, as well as more side effects from intoxication and those sorts of things. But the problem with starting off with those really high doses is that you can reach that tolerance, like Marc was talking about, in much faster. And that's, again, that tolerance we talk about is having to use a higher dose to get the same effect. And we see that with opiates, which is a big downside to them. With opiates for pain relief, especially as patients become tolerant to them, they have to take higher and higher doses to get pain relief, but then that increases the risk of side effects. And with opiates, it can be very serious side effects, including overdose risks with that. But with cannabis, it's more, it's more of just taking a higher dose that can be more expensive. It can lead to quicker tolerance, which means it can be less effective for you over the long period of time than it would be if you got by with the minimum amount of dosing that you could take. A lot of the recommendations our doctors tell patients is what you want to find is, when you're trying to find the dose that works well for you, you want to sort of go start low, go slow. So you'll start at the dose the doctor recommends. If it's not quite working for you, then you kind of work your way up. Maybe you increase it by, if you're taking a half a dropper, maybe you go to 3/4 of a dropper or something like that. And you want to find, once you hit the dose where you find you're feeling a little bit of that side effect, a little bit of that intoxication, you take that and then you back it down just a little bit. And if you want to be on the borderline there of getting not experiencing intoxication but controlling your symptoms, and that's sort of your sweet spot. That's where you want to be for a microdose, or a dose that controls your symptoms but avoids side effects, and also extends the effectiveness, the life of the effectiveness of your medication, because it reduces the chance of tolerance building up quickly for that. Because again, the higher the dose you use, the quicker your body is going to adjust to it and cause tolerance that you might not get at those lower doses.
Also, I think there's one thing to point out here. In my particular case, I have herniated discs in my neck, and I have also swelling that came from a knee operation, from an artificial knee put in. I had the habit of saying, gee, when I had more pain, I'd use a higher THC product. I see some people asking questions and mentioning things like Serene, for example, from Cetera, which is great for pain. I found that when I was using it for my knee, the concept was, when it hurt, I'd take more Serene. One time I ran out of it, and so what I did was I started using 1-to-1 that evening, and I found out my pain started going away. What the doctor explained to me was I was reducing the swelling, I was reducing the inflammation. The inflammation was causing the pain, and so rather than trying to just attack pain, you may be trying to take a look at it, especially with knees. You may want to take in arthritis. You may want to look at also having a higher CBD content to be able to address and to get that inflammation down.
Exactly, and that's a good point, because when we talk about tolerance, a lot of that is due to the THC causing tolerance more so than the other some of the other cannabinoids, just because those CB1 receptors that Cameron mentioned are just more sensitive to tolerance than a lot of, like CBD, for example. It doesn't really directly on those CB1 and CB2 receptors. It actually works in a more roundabout way that controls inflammation, that helps pain, but it doesn't cause the same level of tolerance buildup that the THC, which directly binds to those CB1 receptors, can. This is just a graph to kind of demonstrate what we were talking about here. Higher doses being more effective. You want to find the sweet spot where you have an optimal dose that gives you high benefit with the lowest dose possible here. Because what happens, again, high doses, frankly, they're more expensive and they have more side effects. So you do, from a cost-effective standpoint, from a longevity of treatment standpoint, you do want to find the lowest dose that works well for you.
And especially if you're going after pain, a lot of pain comes from inflammation. And by paying attention to that, I know in my regime, I have a regime that just addresses inflammation and one that addresses pain. And I know I'm very religious about the one about inflammation, because it does have a direct correlation to reducing the pain level in my body.
No, absolutely. Well, and there's actually studies that have been done to sort of back up this concept of using THC and CBD together for a more effective overall treatment. This study that I have here on the screen now looked at 263 cancer patients that were treated with opiates, which are, of course, your morphine-based drugs, your OxyContin, and those sorts of things, and were poorly controlled with those medications. So they looked at this, and they looked at a group that was receiving 21 milligrams of combined THC and CBD every day. And those patients experienced pretty big improvement in pain, actually more improvement than the group that took the higher dose of 52 milligrams a day. And then they looked at one that was taking 83 milligrams a day, and that reduced pain no better than placebo, but had more adverse effects. So we talk about those higher doses almost can overstimulate the endocannabinoid system sometimes when we get to those really high doses. It's interesting. Sorry, I'm getting blown up on the phone here. I don't know if I'm having. Oh, no, never mind. So it's when we talk about overstimulating, there's a good example of that in the nutrition world. We hear a lot about omega fatty acids, and the American diet has a lot of omega-6 fatty acids in food. And what they've actually found with that is that omega-6 fatty acids actually stimulate the endocannabinoid system and cause an increase in hunger, just like the munchies that you get from cannabis. It's just something. It's a side effect of stimulating that endocannabinoid system. And we hear that, okay, well, we need to balance that with omega-3 fatty acids. And what we find is that in the American diet, because of those omega-6s, when we eat more of those omega-6s, we're actually more hungry throughout the day than we would be if we balanced it with omega-3. So that's just an example of how overstimulating or the endocannabinoid system can cause a negative effect or a side effect that we want to avoid. So again, that just demonstrating those lower doses and balancing the overall stimulation of the endocannabinoid system rather than just one specific part. That entourage effect, basically, is really important to loop in that whole endocannabinoid system. It's very sensitive, the endocannabinoid system is, and causes, again, a lot of physiologic effects in the body. Is responsible for a lot of keeping us in balance, our bodies where they need to be. And this was just a cool slide. I thought that really visually demonstrated that effect of tolerance. They looked at these are actually CB1 receptors on cells under a slide, and they looked at them over time as patients were exposed to higher levels of THC. And you can see from A to B to C to D how these CB1 receptors are actually pulled back into the cells, making the cells less responsive to THC over time. This is a visual representation of what tolerance is. It's actually the cells protecting themselves from getting overstimulated by pulling those receptors back into their back into the cellular structure, and not exposing them as much to this wave of THC or whatever stimulant that's coming through that way. So that's just that tolerance building. This is really it in action in a visual form, and what we want to avoid as long as possible by both using, you know, full, not only THC, but all of the endocannabinoids, as well as the lowest possible doses.
Turner, one of the things that the pharma companies have done a great job of doing is they've got us into this one and done kind of concept with pills. Take one and you're done, or and it's there. But I think also that one and done also leads to take more, and what it does is solves the problem. And in many cases, it's not in cannabis. This is more holistic. This is something that tunes into your body. This is something that listens to your body. Pharma drugs don't do that. They come in like a battering ram and just attack your body rather than working with it. And what I'm trying to point out here is that sometimes balancing CBD and THC, in other words, using less but using it more effectively, has a big positive effect on being able to find what you call that optimal amount. In other words, you're not bombarding your body. What you're doing is you're balancing your body.
Yeah, exactly. Well, just as an example of that, this slide we show here, CBD and THC can actually, CBD can actually reduce the psychoactive effects, the intoxicating effects of THC. So using them both together allows you to use a lower dose of THC and get the same benefit than if you used a higher percentage of THC or almost no CBD in a product. So basically, it just shows you just another way of those two chemicals working together to stimulate and to keep the overall endocannabinoid system where it needs to be.
You pointed out something very important that a lot of people missed, and that is that if you're using CBD or THC and you start getting a high effect you don't like, by taking THC, so having some CBD, a bottle of CBD, and taking some CBD will take you down off that high. It'll help you control that. It may take a few minutes to do that, but it'll definitely help you control that.
No, exactly. And this was another study that just sort of demonstrated that. They looked at, again, 177 patients with cancer pain. They used a couple of different products with different ratios of THC and CBD in there. And the one that used the product with a 1-to-1 ratio, that THC to CBD, found really the highest level of response in reducing their overall pain levels with that. Now, the downside to that, when we talk about using them together, it's certainly advantageous to use CBD and THC together. But when we talk about total cannabinoid dosing through the day, you are going to take a higher overall dose if you use THC and CBD together, more than likely, because those 1-to-1 ratios, you're taking say 10 milligrams of THC, 10 milligrams of CBD. I think they use a total of 60 milligrams a day here. So it is going to be, the downside of that is it is probably going to be a little more expensive when we do that in the dispensaries, because there really is no differentiation between a dispensary product and how they handle a CBD plant or a THC plant. It all sort of costs the same to them. So that is something to keep in mind. It is, again, very important. We think, our doctors think, and from a medical perspective, to use these full spectrum products, these products that have all the different endocannabinoids, or the different cannabinoids rather, to get the best effect. One suggestion that we have kind of started to make, and with some patients, since Florida changed put some new laws in place the 1st of 2020 to really better regulate the CBD market in the state. So the quality of the CBD products have improved in the state of Florida. So, our doctors are a little more comfortable maybe suggesting that, okay, we know our THC products can only be purchased at a dispensary. You have to have a medical marijuana card ordered by a physician. But, one option that you have is purchasing the THC product in the dispensary and then maybe shopping around for a CBD product outside of the dispensary that may be a little less expensive to purchase than it would be at the dispensary, again, just because of the amount of handling the dispensaries have to do with those CBD products to make them. It does drive up the cost a little bit.
Turner, yeah.
So we start.
Go ahead.
Yeah, so we started at our clinics just to make sure that it's available for patients, offering these full spectrum CBD products to complement the THC they're getting from the dispensaries, to really, maximize that endocannabinoid system stimulation as a whole. There's something called, there's different kinds of CBD products on the market. There's actually what they call isolates, and that's CBD that's isolated and just by itself. There's nothing else in the bottle other than CBD. There's broad spectrum, which has more cannabinoids than just CBD at very low levels, but very few of them. And then there's full spectrum, which is much more similar to a cannabis formulation, but just the THC level is very, very low. Has to be 0.3% or less federally to be considered a hemp or CBD product. But the full spectrum will sometimes go up to the 0.3% of THC that's allowed under law. So that's the difference between the three. And we find that the full spectrum CBD products, when you complement them with the dispensary products of higher THC, it really gives you the best balance, the closest thing that you want to mimic to really get the full endocannabinoid spectrums. And just as a price comparison, when you look at full spectrum CBD, at least that we're selling at the dispensaries and online, 6 to 8 cents per milligram as opposed to 12 to 20 cents per milligram for CBD at the dispensaries. And again, that comes down, that's not the dispensaries just price gouging. That's just, it is more expensive for those guys to make it the way they have to under Florida regulations from that side of it. So, it's basically the difference between spending, $75 for a THC product and $45 for a bottle of CBD, or spending $150 to $200 for enough CBD and THC at the dispensary. So just something to keep in mind there, and maybe something to shop around on. Again, we offer it in the clinics. We have the My Botanical Wellness that we sell it on online. Just something to think about as an option to start, a place to start. But that is another way to kind of get that full spectrum of CBD, THC that so many studies and physicians recommend. So
yeah, there's a couple of important points here. When you mentioned that you started marketing these CBD products, your doctor recommended. What you saw was there was a need in the market, and especially with the amount of CBD products out, you just don't know what you're getting. You don't know the quality, who's got a quality product. How do you trust it? And I think what you did was, as doctors and as clinicians, is you came in and said, here's a product that you can really trust. And then what I really like about it is you brought it in at a price that's very, let's put it this way, it's probably one of the price competitive products on the market. In other words, it's not just comparing it to the dispensaries, it's to other products that are out there. Having CBD in your cabinet and part of your regime is something that's really important, and it makes it easier to do that.
Well, the problem we saw and our doctors saw with our patients in the clinic after 2 or 3 years was a lot of patients wouldn't buy the CBD in the dispensaries. They were just buying THC, and when we would talk to them about it, it would be because of the cost a lot of times, and other times it's because the dispensaries just simply didn't have any CBD product to buy. A lot of times, the demand is much higher for the higher THC products, so they don't necessarily make a lot of the CBD products a lot of times. And, we had a lot of patients saying, well, but it's, I can't function well with this medical cannabis with a really high THC stuff, or I'm not getting the benefit that I need from it. And so that's really what drove us to say, okay, well, we're really not giving our patients the best experience here if they're not using the THC products with the CBD and the other cannabinoids. So that's why we felt it was very important to really offer that option to give them the best chance for success for the therapy. At the end of the day, that's really what it's all about. It's getting the therapeutic benefit and the results to improve your quality of life. I mean, that's the whole game. So
right, and I think that there's this perception that THC is great for pain, CBD is good for inflammation. But I don't think people should overlook the fact that if the cause of your pain is inflammation, I know Carol brought up about
that's exactly why. Yeah, that's exactly why that the combination of the two works so well. You have a chemical that's reducing your inflammation at the same time you're having the THC block your pain signals. That's just an ideal pain medication at that point. It does a little bit of everything. So that's we see that over and over again.
I know after a couple of years of using medical cannabis, I find myself heading to CBD first before THC when I have pain, because I know in many cases, in my case, whether it's in my neck or it's inflammation in my knee, that will cause the pain to go down. not more THC.
Yep.
Let me put it to you that
Yep.
way.
Yeah, exactly.
But your body will tell you
So
that.
so that's pretty much the end of my part of it. I'm going to hand it back over to Cameron to finish up here before we get to the questions. So Cameron, if you're around here, I think this is your slide to jump back in. So.
Okay, great. All right, you have my screen here?
Got it.
Excellent. All right, so at the end of the day, if you're sitting there at home thinking, you're learning a little bit here, you're thinking, where do I go from here? Most importantly, when I talk to patients and when I meet with people and I think about it, as somebody new to cannabis, or even if you're experienced, don't get overwhelmed. This is a lot of information, but we can really, let's spend the next few minutes trying to kind of simplify things to get a real good start. A lot of the great points Turner brought up were, and he showed you in the studies, the importance of CBD and THC at the end of the day. Using them appropriately together, we know in almost every condition, you're going to have a better chance at having better value. If you're someone that's been using high numbers of THC and you keep bumping it up and you're not getting relief, and Turner and Marc were talking about tolerance. The great thing about cannabis is it's okay. We can reset ourselves. We can start fresh. It's called a drug holiday, really, is what it's coined, and it's used in a lot of different areas of medicine outside of the cannabis space. If you take a weekend off every once in a while, now that if we bump our doses too fast, what happens, if you remember from that slide, I was showing you some of the anandamide and things like that, and Turner was showing you how the cells take things back in and down regulate. If all of a sudden I'm not taking anything and I give myself a bunch of something, the body starts making less receptors. It's like, well, I don't need to make my own. It's already here. I can just chill out. Well, it's got, and so basically you're actually working against yourself. But by taking a break, unless you're on super high doses and for a long period of time, then you may need to take a month off. But just a Sunday reset, Saturday or Sunday, can really click you back in order a lot of times. So don't get too stressed out about that, for sure.
You brought up something really critical, and that is that if you're using medical cannabis, I know that about every 6 to 8 weeks, what I'll do is I will stop using medical cannabis for about a day to a day and a half.
Yeah.
And what I'm doing is exactly what you said. I'm saying to my body, listen, don't get lazy. You have a basically bodily function, and yes, it is being assisted by cannabis, but I still want you to do your job. Now,
Yeah.
you might say, why a day to a day and a half? Because after about a day, my body starts telling me, hey, I know that's what you want to do, but you got pain, pal, and you better do something to address it. So I'm not addicted to marijuana. That's not it. What I am addicted to is getting rid of my pain. And I found a natural way of doing it that I can do it in a way that I don't get high, I don't have negative side effects. But I do know that when I don't take it, the pain level goes up tremendously. I get back to where I was beforehand. So the holiday is really important, I think, to really let your body do the work. And it also let you get more out of the cannabis that you buy. You get more bang for your buck on the cannabis that you're using.
Yeah, for sure. And I see it every day, and I see it some of the comments in the chat. I think there's some patients, I'm not getting enough relief, or what do I do here? So let's kind of work through some of that. So I've seen a few questions in the chat. I get it a lot. Our docs get it a lot. One tip, as simple as it is, but as important as it will be, in my opinion, for you, is to keep a journal of what you're taking. So I'll get phone calls, our physicians will, and they'll say, hey, I go to True Leaf and I take a 0.5 milliliter of this bottle. Okay. The bottles at the dispensaries are changing all the time. You've got True Leaf, you got Grow Healthy, you got Curaleaf. It goes on and on and on. The formulations are changing out all the time. But what's not changing all the time, ever, is the milligrams that you can dial in your journal, is the milligrams you're taking. So instead of looking at it like I'm taking a dropper full of this, if you can take a moment and look at your bottle, you can find out that one dropper full equals, maybe it's 10 milligrams. So in your journal, if you write down, I'm taking 10 milligrams of CBD, or I'm taking 3 milligrams of CBD, no matter what product or dispensary you go to, a milligram's a milligram. And you're going to cut out a lot of that confusion, because each dropper full at each place of each product is going to be, for the most part, can be a little bit different. So if you can focus on milligrams of CBD, milligrams of THC, that's a really good starting spot. Another thing I see all the time with patients is they want to get better quick. Who doesn't? I get it. And in a lot of conditions, you can get better pretty quick. Sleep, anxiety, pain. Some conditions, Parkinson's, for example, you can get better with some of the symptoms quick. Some of them, it can take 3-4 months. Epilepsy, it goes on and on. So you really gotta, I see a lot of people quickly jump to high doses. Oh, I took it last night, I didn't feel better. Well, your body's turning on more receptors. You got to take your time with it. And if you do it, you'll find that dose without just overshooting and chasing it, if cannabis is going to work out for you. I spent a lot of time at different conferences throughout the country, a few out west. And to Turner's point about microdosing, I think it's huge. I think it's super important, and the evidence is there. So what the physicians out west and even in Florida have found is what they call the minimum psychoactive dose, which is what Turner talked about. So let's say we're sitting there brand new, maybe we're not getting the results we need. Okay. We know from Turner's presentation in the studies that CBD and THC together give us the best shot to get better. So let's just simplify things down to 5 milligrams of CBD, 5 milligrams of THC. So when Marc talks about a 1-to-1 ratio, that means equal part CBD, equal part THC. So for most patients, and if you're one sitting there, well, I'm super sensitive, don't go with 5. Start with 3. It's okay. But for this example, and for most patients, let's do 5 of CBD, 5 of THC. Unless we have an epilepsy type condition, I'll talk about that. Let's just do that twice a day. If you have pain and it's not in the morning, just do afternoon and evening. If it is in the morning, do morning in the middle of the day. You can do it twice a day. You can do it 3 times a day. It's fine. Nothing to stress out about. So with this minimum psychoactive dose that Turner talked about, what we can do is 5 milligrams, for example, twice a day, do it every day for 7 days. Don't jump around because it didn't work, anything like that. And at day 7, if you're not getting the relief you need, let's bump it up. You can go, for example, from 5 to 7, 5 to 8, right in there. And let's move up. If we get to and we'll go another 7 days. So keep your journal, write down your milligrams. Let's go every 7 days. Let's change. Okay. Now, let's say we get to 10 milligrams of CBD, 10 milligrams of THC in this 1-to-1 formula. And now I'm getting, in the medical field, an adverse effect, a psychoactive effect. I'm getting a high and that, I'm not saying that's a horrible thing, but you don't necessarily have to get high to get better. Most people can't function, go to work during the day like that. I mean, I wouldn't recommend it. When we hit that point, so say we went 10 to 10 and we got this event, let's back down, back to 7. So it's like, just like Marc said, just because I have a sip of beer doesn't mean I get drunk. Just a little bit of THC doesn't mean I get high. So now we're at 7, for example, in this example, for a week, and I'm better, or let's say I'm not. Okay. What we're then going to do is, if we up that THC back to 10, we know we're going to have that event. So we're going to do 7 and 7. And to get better, now we're just going to raise our CBD. So now we're going to become 7 to 10, 7 to 15. And we'll keep raising that up until the point that we get the response that we need. Okay. In most patients, roughly 30 milligrams combined. So it's 20 to 30 for most people will probably, you probably work out. So when I'm saying 10 of THC and 10 of CBD twice a day, that's 10 and 10, that's 20. And then the evening dose is another 20. We're at 40 milligrams a day right there. So somewhere in that window, you're probably going to get close. So do your one-to-ones, move your CBD up until you get better. If you're not getting better, what we can do is we can start to play with those other cannabinoids a little bit that were on that wheel, or we can try different strains that have those different limonene, pinene, things like that to help to give you the better response. Those help you dial in. But it's all about starting low. It's all about going slow. It's all about not overdoing it and turning those receptors off. It's gradually getting your balance, because each of us are different at the end of the day. With most medications, we can say, I give you 25 milligrams of metoprolol blood pressure twice a day. I'm going to decrease your heart rate and your blood pressure by this. With cannabis, it's not so simple. For example, people with fibromyalgia, people with migraines, they're finding they have low AEA, low endocannabinoids, low tone. They may need more. That's why they're having these issues. So it's all about starting low, going slow, not getting overwhelmed. We've waited this long. No reason to just triple a dose because we're just chasing it.
But you also mentioned something that's really important. And that is that what I found, again, I have two regimes. I have one regime that really addresses the inflammation in my body. And I have another regime that addresses the pain. And what I found was I found a Delta 8 product, about Delta 8 vape pen, that when I started using it, and again, this was when I had I started using it when I had my knee operation, and I still use it actually today. I carry it with me religiously. This Delta 8 vape pen, literally when I take a hit off it, 2 or 3 minutes later, my pain will go away. I mean, this stuff, in my opinion, for me, at least in my body and what it does, is better than Percocet. And that goes back to what you said, Cameron. When you get to a certain level where you know where the THC and CBDs are, you can also take a look at the type of product that you're taking. And this is where you talk to your doctor and you talk to your dispensary. They can help you dial in. In fact, I was turned on to this product by a dispensary personnel, and it really has helped me quite a bit. And I think that's something that is also part of the consideration.
For sure. Yeah, it's the keep it simple, stupid philosophy that we see in a lot of our daily lives. Don't jump in, is my recommendation, with all these wild ideas and changing all these cannabinoids in the beginning. Try to do the one-to-one, get where we're at, increase that CBD more and more and more, see if we get where we're at. Almost all of you will achieve results. And if not, that's when we can start to play with some of those other items. If you're somebody in here that you're like, okay, I just heard you, THC, CBD, they're important. They're the most important to work together, clearly from the evidence, but you're someone I'm not going to use THC, period. It's a belief. It's whatever. That's okay. Cannabis can still work for you, and it can work very well. Like Turner mentioned, you may need higher and higher levels of CBD. Maybe not. Some people don't. But there is an option for you. Now, the reason I bring this up to you right now is I want you, if you're one of these people, and that I want you to watch out for ratios. So we're talking about 1-to-1. Well, when you go to a dispensary and you want a pure CBD product, it's going to come from the cannabis plant. So it's going to have some THC in it if you get it at a dispensary. When they say, like, I've got a 12-to-1 ratio, I've got 12 milligrams of CBD for every 1 milligram of THC, okay? If I'm gonna double that, now I'm gonna have 24 of CBD and 2 of THC. If I'm gonna go up again, I'm gonna have 36 and 3. You gotta be careful, because once you keep going up on that CBD, and a lot of patients with seizure disorders need high levels of CBD, that THC will eventually catch up with you, and you're going to be using more than you intend. So you're going to want to look for a product that's got the highest level, highest percentage of CBD, if you're in that camp, that you can get, and keep that in mind. What's really great.
There's at least one dispensary, 2 dispensaries that they'll market these products and it'll say it's a THC or a CBD product, and you say, why are they doing that? Because they let you adjust the amount of CBD and THC to address your situation. In other words, they let you choose the ratio, they let you manage the ratios, and I find it to be very, very effective.
Yeah, for sure. And when you're doing your, to your point, Mark, and if you're listening out there, when you get to your 1-to-1 ratio and you get where you're good, but then you start bumping that CBD, if we've written down in our journal, okay, I'm doing 5 THC and 15 CBD, I can now switch to a product that's a 1 to 3, right? Like it comes pre-mixed, whatever that number is. If you know your milligrams, then you can start playing with ratios without getting overwhelmed in the beginning, for sure. What's really fantastic, again, me and Turner are pharmacists. So what we really like about this space is it's become very normalized medicine. It used to be, you know, people would call and, you know, I smoke this joint, how much am I taking, this kind of thing. And I have no idea. I can guess, you know, I don't know your dealer, but with normalized medicine, with Florida laws in place, what we know is we're getting on each bottle what it says it is. They have to prove to the state that is the amount of milligrams in it. They show all of these guys, due to competition or philosophy, are growing organic product, pesticide free, things like that. So now, instead of just, you know, I was pre-treating on the, I guess, the black market, whatever, now I can go to a dispensary of my choice, and every time I go in there, I pretty much know I'm getting the same thing every time, which I think is incredible. And I'm so glad we're here. It wasn't here when I started in Florida. And finally, we've made great gains, in my opinion. I get a lot of questions. I've seen some in the chat about I'm using drops. What dosage form do you recommend? It, you know, comes up obviously a lot. And honestly, they all have a great place in therapy. They all have their benefits. They all have their drawbacks. For example, if you do sublingual drop, the ones that go in your mouth, the drops under your tongue, one thing you want to do, a caveat with that, and people aren't often notified, is you want to let that sit in your mouth for about a minute before you swallow it. You'll get more out of it. What happens is it gets absorbed in the gums and the cheek and the buccal region, and then that medication, that cannabis is actively working your body ready for use. If you immediately swallow that dropper full, it goes into your stomach, your liver breaks it down, and not as much of it's available to you as it would have been if you would have held it there, you know, in your mouth. Drawback with the sublingual drops, good part is it lasts, you know, fairly long, 4 to 6 hours. Downside, it takes a little bit to start working. You know, the vape pens, for example, some people like that. The great side about that is it helps quickly with, you know, breakthrough pain, like, you know, almost immediately. If you're having a problem, the downside is, you know, it wears off quicker. So you got to think about when are you experiencing your symptoms? When are you needing your relief? For most people starting out, generally my recommendation is to go with some of the sublingual drops. Do it 2 times a day for a week. If you're having breakthrough pain like that, you know, you could consider adding a vape, just for that as needed quick dose. If you're having arthritis in your hands and you're doing the sublinguals, some people have done great with their topicals added on. You're not really getting any absorption for a high or euphoric feeling from the topicals, so not much to be scared about there. Some people don't like cream, so that, I mean, that's not for you, and that's perfectly fine. But they all honestly have their value. It's where do you want to get started?
Go back for 1 second, Cameron. In my case, when I wake up in the morning with the herniated disc in my back, I have a level of pain that's a 7 or an 8 if I'm not using cannabis. So what I want to do is I want to take a sublingual drop, and when I get up in the morning on my nightstand, I have sublingual drops and I will take them. But that takes about 20 minutes, 25 minutes to work for me, and it'll work for 4 to 5 hours. So what I do, because I want to get this pain level down, I have a vape pen. and I take 1 or 2 hits off the vape pen, and literally within 1 to 3 minutes, that level of pain will reduce from whatever level it is, 7 or 8, down to a 1.
Yeah.
And the first time that happens, I remember saying to my wife, well, I just couldn't believe it. It was like, whoa, what's going on? And even when I did it this morning, it was the same thing. It's just remarkable. But you can mix and match these dosing methods, and that's what I recommend. While the drops are kicking in, you can use a vape pen. If you don't like to use a vape pen, you have a topical that you can use, for example.
Yeah, you certainly can. But in the beginning, or if you're not having the results you're looking for, keep it simple, stupid. Start baseline before we get there. Is just my encouragement. And as you mentioned publicly here, Mark, you've been using for a couple years. So
right.
For the new beginning people, don't get overwhelmed.
And that's a good point. You got to know your baseline, but once you know your baseline, then you can actually take a look at the different forms to be able to dial it in.
Absolutely. So here's another pitfall I see, and I don't want you all to make a mistake, which you probably have read about or hear about, and it's kind of I don't know, it can become a joke sometimes in some of the television programs and things like that. It's the difference, like I talked about with the absorption and the gum before you swallow it. That's readily available before it goes to your liver, so you get your constant, consistent dose. Well, you can kind of see from this graph, the main point of it is whenever I, take an inhalation, for example, of THC, it comes up and it wears off, in a just like the graph, like a regular pattern. When you switch to a different product, the bottom right, that's an oral edible type formulation. It's drawn out. So usually you take that inhalation dose and you're like, okay, that worked. But then say I switch to an edible, which are now readily available in Florida, and you're like, nothing happened. And it's minute 30, minute 1 hour, for example. And you're like, okay, let me take another one. Well, what's happening is, first of all, your stomach's breaking it down. So it's taking longer to even start. And then the caveat from this slide is whenever on the right, whenever your liver breaks it down, it changes it to a new chemical. So it's THC, which is called delta 9 THC. Now it becomes 11 hydroxy THC, and it's 3 to 7 times more potent than if you just took regular THC. So an edible, you may need a lot less than if you were to inhale it. Everyone metabolizes differently. So it depends on the person. My word of caution is, if you're like, oh, my dose is 10 milligrams and I'm going to take an edible 10 milligram, nothing happens quickly, give it more time, because if you take another dose right away, come hour 1, now that first dose is kicking in. You can really set yourself up for a bad day. So start low, go slow. Be careful when you switch between dosage forms, but specifically the ones that you swallow, because your liver is going to change that chemistry of a THC product to a more potent product. Worst case scenario, pretty much.
The best way, what you're really saying is be cool. There's a lot of people who will take, let's say, an edible, and because it didn't work in 5 minutes, they take another one, or they take more of it. Give it time, because what you're doing is, by taking more and more of it, is it'll all kick in. It'll just kick in an hour, 2 hours, 3 hours later. And like you mentioned, you'll end up in an area that you may not want to be.
Yeah, absolutely. And I like when I prefer when the patients that I work with do dosage adjustments on the weekend, assuming they're not working on the weekend, just in case, especially when you're trying to find that dose. You don't want to get to work and be like, but if you start low, go slow, do these small doses, it's not going to happen to you. You're going to be fine. As Turner mentioned, this is a statement from the WHO. It's been in effect for a long time. There's no reported fatal overdoses in the epidemiological literature from cannabis, which as a pharmacist, again, is super exciting. When Turner talks about opioids, those are the Vicodins, the morphines, the Lortabs, and so on and so forth. We know from the literature that you may have a bad experience because you took too much. But you're not going to die. Kind of a big deal. primarily the reason for that is the receptors in the brainstem are so low. That's what caused that. The brainstem's what controls respiration and breathing. And so if we're not shutting those down, it's a big win. And that this chart here just reinforces that. If you see in the middle, you'll see alcohol. Is at a 10. Basically what that means, this is the ratio of fatal dose to effective dose. Basically what it's saying is like, if 2 shots get you drunk, for example, 2 times 10 would be 20, could kill you. Marijuana is way up there. You would need so much. And I think one of the physicians that I studied under out west, he had broken it down to, if you had a brownie with 100 milligrams of THC, and remember during this call, we've been talking about starting with 5 milligrams, so 100, so 20 times that. A brownie with 100 milligrams, you would need to eat 1,000 brownies in one sitting to give you a 50% chance that you may, could be fatal. But that's not really probably not possible. So that's a relief. Drug interactions, obviously something that's important to us. For the most part, fortunately with cannabis, especially at these normal doses, not at regular therapeutic doses, drug interactions are pretty nominal. If you're on a medication that has a narrow therapeutic index, meaning I go to my doctor for blood work all the time because of my seizure medication and I need it to be in this window, or my Coumadin because of warfarin, I need it to be in this window. Something, ideally they're aware of and you watch, just to make sure you're not throwing it with increases in use of cannabis. But for the most part, aside from that, drug interactions are pretty minor, which was encouraging. Adverse effects, tired, dizzy, we know that. A lot of that, some people want to be tired. Some people will pick that indica, high myrcene type product to help them sleep. Some not. Dizziness, nauseous potentially, and for the most part, generally these are at the higher doses. Anxiety, we get a lot of patients being treated with anxiety and doing quite well. CBD can do really well for anxiety. THC also can, but remember Turner's point, we see in anxiety a lot of times when you get too much THC, you push it, it can cause anxiety. You get over that curve and you start getting more. So don't be too aggressive with the THC portion until you get your dose dialed in when it comes to anxiety and things like that. This just reiterates the safety profile, 97% adverse effects deemed not serious. And that's pretty much, I hope that was somewhat helpful to help you think through the process of the cannabis you're going to use, understanding some of the dosage forms, and just remember, keep that journal. If you focus on milligrams, you're going to be way ahead of the other patients. Start low, go slow, changes every 7 days. I recommend 1-to-1 ratios for almost all conditions. Seizure disorders, those are ones that THC has value, but you're going to end up needing a lot more CBD generally. Watch out so that THC doesn't creep on you too high, but you could expect for seizures disorders anywhere between 50 to 2,000 milligrams of CBD a day. That's something we can talk about offline on a one-on-one basis, for sure.
Sure. Why don't you stop sharing the screen, and what we'll do is we'll answer some of the questions. How does that sound?
You got it.
Okay. Maybe Turner can join us and we can jump into a few of these. There's a couple of them that are kind of really straightforward. Do you want to pick one, Cameron? You want me to go through the list?
Let me see. Here's Turner. I think Turner, if you don't mind helping me pick some of these questions. I saw something on here. I've lost it now, but it was about weight loss. Oh, here we are. It's a combination or alone THC or CBD for weight loss, or can that cause high weight gain? So that's a really good question. So with cannabis, we hear about the munchies, weight gain, all that kind of stuff. It's almost something to think about. It's important to a lot of us. What we've been amazed by, honestly, is that the amount of patients we have losing weight that are on cannabis. And from the clinical side of things, what we're learning from a lot of these patients, particularly those that are experiencing pain, what we're finding out is these patients are quote unquote getting their life back and being able to get up, move again, walk again, maybe play golf again, things like that. They're actually doing, vast majority are doing incredible and actually, losing weight. In theory, THC does have the potential to increase weight gain, but at these normal low medical doses, most people are doing great. Just keep an eye on it, but don't be scared, because we're seeing people lose weight when they want to.
I think also one of the things you're finding is when your body starts functioning properly, which is what medical marijuana helps you do, it does help you lose a little bit of weight. In other words, your body's being a lot more optimal about what it's processing the food and things like that. But it does help. Let's put it that way. It's not a magic wand to lose weight, though. That's not what it's here for. Okay.
Yep.
There was one question that I saw. I think it was. Let me see if I can find it. Dawn was mentioning I have herniated discs in my lower back and arthritis in my knees and hips. When did they stop approving medical marijuana for arthritis or pain?
Okay, yeah, so that's a great question, and quite frankly, it's misinformation within the medical community, in my opinion. So, whenever cannabis was allowed for patients in Florida, with the THC Amendment 2, I guess it's 4 years ago at this point, what they did was they said you had to have all these different conditions to qualify. So, for example, you had to have multiple sclerosis or Parkinson's or cancer or HIV, or I could list them all for you, but a lot of very debilitating conditions, or a qualifying condition of the same kind or class as or comparable to, is how the law reads. So when you're somebody with arthritis, what the doctor has to do, we've got tons of patients with arthritis. You have to submit to the department studies showing that arthritis can be relatable to one of these primary conditions. And also that there's a study showing efficacy of cannabis in that condition, which is what we do all day long at MMTC. What I think what you're getting after, because you were on it and then you weren't, what had happened is a lot of these physicians, one of the qualifying conditions in Florida was chronic non-malignant pain. And what a lot of the doctors read that as is chronic non-cancerous pain. But if they actually understood the law, that only applied if you had cancer, if you had MS. So the state changed how they would put it into the system, and all these people that they had been marking as chronic non-malignant pain, they found out suddenly that that option was no longer available because they were using it right. What would occur, and you do qualify at the doctor's decision, but like I'm saying, we have a lot of patients in that condition. And we've gotten a lot of patients from a lot of different places because the doc just didn't keep up with it, didn't understand, didn't have the studies, didn't put the time in. What we have to do is we just have to submit more documentation to the state saying we're approving somebody with arthritis. This is how it's relatable to another condition. This is efficacy. This is safety. You're good to go. And you're back in business. Not everyone kept up with that.
It's safe to say, just because you don't see that medical condition on the list, go talk to the doctor, because in many cases, the doctor can, in fact, file paperwork and has the ability to be able to get you approved. I've heard
literally hundreds of conditions in Florida, and you can't, when you're in the legislature, and of course on that advisory panel, you can't spell out every condition and the derivative conditions and all of that. So where the state did a good job, in my opinion, is they didn't put the doctor too much in a box. They left leeway, to work with those patients.
Cool. Turner, Cameron, you want to grab a question?
Turner, I think you're on mute here.
Yes, I am. Yes, I was. Got one here. I see from Kevin says, I have a pacemaker. Does THC increase the heart rate? And if so, how long will the rate stay increased? THC specifically can increase the heart rate, especially at high concentrations. So that is something to be careful about if you do have, heart arrhythmias. Something to keep in mind. It'd definitely be something to talk to. Definitely mention to your doctor if you do decide to go that route. It's not necessarily a contraindication. It's just something that the doctor needs to be aware of and make a determination if you're a good candidate or not, based on how well your arrhythmia is controlled, all those sorts of things. There's a lot of factors there to look at, but definitely something to be aware of.
Cool.
I got another one here asking about COPD, asthma, sleep apnea. Would inhalants be a good option? Probably not the best route to start with. If you have those sort of breathing problems, any kind of irritation just makes them worse. It's not that inhaled cannabis or vapes are inherently any worse than any other type of inhalant, but they can still cause some irritation and coughing, especially if you're not used to using them. So I would definitely suggest using an oral, a tincture, edible. There's a lot of options out there that will really provide a very similar effect. The biggest advantage of the inhaled products is the rapid onset, is how fast it works, and really, that's not, it's good to get that quick effect, but it's not. You can get the same benefit from other dosage forms as you can from an inhaled dosage form. So I don't think you're missing out by not using an inhalant. So
there's a question here. It says, are tincture oils like an edible? And basically, when you look at that, it can be if you swallow it, because if it doesn't stay in your mouth and it just completely, goes right to your stomach, it goes through what's called first pass metabolism, just like when you chew up and swallow quickly an edible, and then it gets treated really the same. That's the importance of letting the sublingual sit in your mouth for a minute, ideally, because it gets absorbed into the bloodstream and then doesn't immediately go to the liver. It gets to your body before the liver crunches it up and breaks it into different things. Why does a spray, maybe you got a thought here, Turner, why does a spray work faster than sublinguals? And we've seen this, the Sativex use sprays, particle size. You have any thoughts there?
I think, it really, theoretically, they shouldn't be a big difference in onset, but, it could be that the sprays, you actually get a little bit of absorption through the pharynx and the nasal passages that are a little more, rapid onset there. So that may be the result of some of that, just reaching some of the sinus cavities and things like that, as opposed to a sublingual where, you just get, it's fully oral on the absorption. So yeah, theoretically it shouldn't, but there may be some ancillary, mucous membranes that it's touching that gets it quicker. So.
For sure. Would you want to combine, if you want to use CBD and THC like it's been recommended, would it work to get the CBD with the THC instead of buying both separately? So yeah, for sure. If you're able to do the 1-to-1 CBD THC, those are all combined in one formula. When you got to separate it out is when you get to a point that you need to alter your percentages, and you may need to buy a separate product to get more of the CBD by itself. But you'll save money that way sometimes when you can buy a ratio of 1-to-1. Alternatively, you can get your CBD from a place like Turner recommended, mybotanicalwellness.com. Sometimes it's hard, unfortunately, to get CBD in the dispensaries consistently. You go this week, they have it. You go next week, they don't. Legislatures making rules requiring dispensaries to make a CBD product because they know this is a problem. But at the end of the day, CBD, the chemical, is CBD if you get it from a reputable source.
Yeah, and I think you have a choice whether you buy the 4-to-1, 1-to-4s or ratios, or you actually, do it yourself. Like I mentioned, some dispensaries have their mantra or their the way their products work is you buy a CBD or a THC product. So you can go kind of either way. I think the question is cost and how comfortable you are doing that.
Agreed.
One of the questions is, does a spray work faster than a sublingual?
Yeah, I think we just touched on that one, Mark.
Okay.
I see these questions about 0.2, 0.3 mLs of a specific product. They just change so often.
Yeah,
Go ahead.
yeah. I was talking to Carol offline on that one, so
Understood. Thank you.
Cool. You're talking to Carol, so I'll leave those questions alone. Says I actually did you see the question from Leona? I actually chew up the gummy and let them act like a sublingual. I try to wait at least 5 hours in between dosing with edibles. What's your thoughts on that, Cameron? Or Turner?
Yeah, I mean, there's nothing wrong with it. There's just not. If you want to get into the nitty gritty, I don't know if the dentist would be thrilled if there's a lot of sugar in the product, but as far as taking, the product that way, and especially if it's working, go with it.
Yeah.
I see a lot of there's maybe Turner, maybe you can take a question because I know you've answered some that I'm unaware of. I don't want to.
Yeah, I'm typing some here while you're answering, but are there liquid gel caps for the CBD? Yes, they do have. There are available, mainly over the counter or non-dispensary, but yeah, they do have capsules, liquid oil fill capsules of just CBD.
My Botanical Wellness site sells them.
Yeah, we do have some on My Botanica as well, I believe.
Right.
Yeah, typically 25 milligrams or so is what the capsule strengths are for that. I got one here. A lot of talk about Delta 8 products as well. Do dispensaries carry this? Is it the same as CBD? So Delta 8 is sort of a new thing on the market. It's actually it's one of those cannabinoids that it's present on the cannabis plant in lower concentrations. It's also present in hemp and a lot. So Delta 8 is both available in non-dispensaries as a sort of hemp-based product, or certain dispensaries carry it as well. That comes from the marijuana plant. Same chemical. It's good for pain. It doesn't have the same intoxicating effects as regular Delta 9 THC does. So that's the advantage that a lot of people have. But yeah, a lot of people really like it for pain control. So it's something definitely if it's something you'd be interested in trying. Again, the big advantage is it doesn't have as much intoxicating effects. Now, that does have, you do have to be careful with the route of administration with Delta 8 because it is still a derivative of THC. So when you take it orally, like a capsule or a gummy, it does convert in your body to that 11-hydroxy THC and can be intoxicating. So that is something to be aware of and careful about when you're using that. So, but yeah, just another derivative of cannabinoid there.
Yeah, Baca was asking me if the dispensaries carry it. I'm a Delta 8 fan. I just believe in it. For pain relief, it's been a miracle worker for me. But not all dispensaries carry it. More and more are. I think it's becoming more popular, and they're starting to produce some. But some do and some don't. And like you mentioned, you can also get it in the CBD form, like in My Botanical Wellness. But chat with the dispensaries. They'll tell you if they have it or they don't have it. That's way of putting it.
I got a question here. It's so I want to make sure I was clear, at least helpful to some of y'all. How do I focus on, unless you've answered this, how do I focus on milligrams when I'm taking milliliters? And as most of us are aware, milliliters is a liquid dosage form. Just like any liquid medication you take, like a cough syrup, maybe you take 5 milliliters. On the back of that bottle, it will say for every 5 milliliters, I have this many milligrams of whatever the drug is, like 325 milligrams of Tylenol and 10 milligrams of dextromethorphan, for example. On your cannabis package, it's going to say somewhere on that bottle, or on the paperwork, 1 milliliter has this many milligrams in it. So if I take a half a milliliter, you know, you'd have to do the math. If 1 milliliter is 10, half is 5, and record that, you're going to be a lot more successful.
Every product here in Florida has been tested, and it has what they call a certificate of analysis, a COA. And if you look at, on the side of your bottle, you should have a barcode that you can use your cell phone, put it there, and it'll pull up the COA. If not, call the dispensary. They will give you the COA for your product, and that's important to understand.
Well,
it's easy.
Or use the websites too. All of the dispensary websites have products with COAs on there too. There are actually good resources for specific products. Their websites are on that.
Yeah, but all the companies make that information available. Like you mentioned, websites is a good site, but start with the bottle. You'll probably find it on there. Are we doing our questions?
Well, I think we've gotten through most of them here, so we'll probably let everybody get back to it. If we appreciate everybody hanging in there with us. He's always appreciate the opportunity to answer questions and get some good information out there that's hard to find a lot of times. So,
yeah, I think that. Do you have any closing comments, Cameron, you want to make?
I just want to thank you all for participating today and being involved in knowledge and learning is crucial and key to advancing the industry and taking care of your health. The fact that you're here is huge for you, your friends, your family. Don't get overwhelmed. It sounds sometimes hard, but if you go slow, you're going to be okay.
Yeah, dosing is important. Your doctors will help you. I know MMTC, which you represent, Turner and Cameron, you have a dosing center. You can call and get put you in touch with information. Dosing is really critical. Your dispensaries all have consulting services associated with them, so you can call. They're free, so you can call and you can actually talk to somebody about their products and how they apply to you and what products they recommend. That's a very good resource that's out there. But I think also one of the most important things is what Cameron was saying: journal, figure out what you're taking, understand what you're taking. See the patterns that are there, and then more importantly, listen to your body. I mean, my body has told me more about what I should and shouldn't be taking than any medical doctor that's out there. My body will definitely let me know if I'm taking too much THC or too much CBD or when I should take it. As I mentioned, I learned that CBD gets rid of pain because it gets rid of inflammation. So listen to your body. That's a very important part that's out there.
I think one of our moderators just wanted to mention on Wednesday, I think we've got a new topic coming up. Mark, are you cancer, is that coming up?
Right. I was going to mention that next Wednesday, we do these webinars every week. And next Wednesday, we have a webinar on addressing cancer. And it's one of our more popular ones. And my co-host is Jennifer. She's from Truly. Jennifer is a cancer survivor. She's someone who used medical cannabis to address cancer when her doctors gave up on her. So it's very interesting and very informative webinar. Please join us next week. You can sign up for it at Marijuana Aware, the same place you signed up here. But more importantly, we'd like to also thank you for your participation tonight. This has gone long because we had a lot of questions. It is an important subject. As a follow-up to this, you'll get an email. And in that email, you get a copy of you get a YouTube video, a link to the YouTube video of this presentation, to this webinar. It'll have the presentation, and it has a bunch of research information as well as follow-up notes. So you'll be able to, you don't have to type out a lot of things. You'll be able to see the webinar that's there. And please tell your friends, and please tell your family all about what we're doing if you enjoy it, and give us your comments. We appreciate you being here, and thank you very much for participating.
Thank you. It was a pleasure.
Great. Thank you.
Thank you.
Appreciate it, guys.
Bye.